Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. There are 3 primary ways you can join our broadcast. Join us live by clicking the link in this video description and following the instructions to allow access to your camera and microphone. Then, a show moderator will be available to assist you further. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone. Welcome to AFSPA Live. AFSPA Live is a live video broadcast Q&A session that we stream the last Thursday of every month at 11 a.m. Eastern. My name is Maddie Norton, and I'm excited to be moderating the show today. I'm a junior communication coordinator at AFSPA, and today we are discussing general questions about AFSPA and the Foreign Service Benefit Plan. Today we have AFSPA's Senior Director of Ancillary Insurance Programs, Adrienne Coleman Seabrooks, and of course we have AFSPA COO Kyle Longton with us today. Really excited for today's show. If we want to go ahead and get started.
Good morning, everybody.
Great. Hey, everybody, and welcome, and thanks for joining us. Adrienne, thanks for being here. Adrienne's actually in our office. I'm joining from my home. And Maddie, I think we've got a number of questions, not just about FSBP, but also about our ancillary program. So let's jump in.
Yes. First one we're going to start with today is, how can you find doctors that focus on preventative health with nutrition, exercise, and appropriate testing?
This is a great question, and I assume this is for an FSBP member, and I see that there. They've identified themselves as such. And I think you can go into the provider search tool, and you can just go to afspa.org/FSBP, and there's an option on the side for find a doctor, and you can search for whatever kind of provider you're looking for. You can look for, general practitioner, internal medicine. You can look for nutritionists and dietitians and so forth who are in network. And when you go in network, you get the best deal, basically. We've negotiated discounts. We pay a greater percentage. The deductible is less for the calendar year and so forth. You may also get the doctors who are identified and who are in network and providing preventive care, and that seems to be what we're talking about, should be able to provide the types of advice and counseling that you're looking for. I know this comes up in my annual visit with my provider each year. How are you eating? Are you exercising? I got a referral to a nutritionist from my doctor. Referrals are not required within the Foreign Service Benefit Plan, but that may be a helpful way. And so I encourage you to use that provider search tool. We're approaching 2 million providers nationwide for those who are in the U.S., and that's a great place to start looking.
All right. I'm going to go ahead and throw it over to Adrienne. We have a question about life insurance with the GEL benefit. If I add a dependent, could that money be used to help cover immediate death expenses such as cremation? And can dependents be adult children and or grandchildren and or adult siblings?
Excellent question. So I'll take one at a time. You are always eligible to add a dependent, an eligible dependent. So that would be a spouse, a registered domestic partner, and children or a child age 19 and over. If you are looking to cover a dependent, you can cover your domestic partner or your spouse under your policy, and children can be covered up until age 26 or 19, whichever you prefer. So yes, The answer is yes. That death benefit can be used as needed. So you can use it for death expenses. You can use it for generational wealth. Once that reimbursement is sent to the beneficiary, they can use as needed. And can dependents be adult children? So no. Well, yes and no. I consider an adult to be age 18. So you can cover that adult until age 26 under your plan. However, any dependents age 19 and over is eligible for their own policy. Unfortunately, grandchildren are not covered under the plan.
And Adrienne, I'll just jump in. When we talk about immediate death expenses with the GEL benefit, to pay the benefit, it takes a little bit of time. The beneficiary has to submit, or an executor, someone like that, has to submit a certified death certificate. Is that right?
It is. You are absolutely correct. So it does take a little bit more time because it has to go through the underwriting department as well as the claims department, and they will require, I don't think it has to be an original embossed death certificate, but it will have to be a copy of the death certificate. We're seeing a turnaround. Unfortunately, we haven't had a lot of death claims lately, but it's usually about a month turnaround between filing the claim and actually receiving the reimbursement.
Okay, great.
We have another question kind of on that same topic. Someone has asked, how can I prepare a document that lists all my benefits in a checklist format with links to give to my estate planner for my beneficiaries to access in the event of my passing? And they said a one-stop shop that is easy to understand.
This is a great question, and this is something, and I'm sorry to say, it's probably been about 6 years that we offered through our Senior Living Foundation at an event we did. Let me go and I'll encourage this person to reach out to me. There are some great resources online. I think the one that's coming to mind, and this is not I'm not promoting this necessarily. It's coming to mind as a resource we've used in the past called A Place for Mom, and it's a website. I think Joan London, who used to be on the morning shows, used to promote this website. But I think they actually had a printable checklist where you could include account numbers and things like that. But please reach out to me. I have something in my files, not immediately accessible right now, but I'd be happy to provide some resources and some questions. My thinking is that actually your estate planner, if this is a financial advisor or an attorney, should be able to provide you with a document where you can fill that information in terms of how to get that information. If that's the question, if it's something that AFSPA has a policy, whether it's life insurance or even your health insurance and so forth, what's covered there, feel free to reach out to us. We can provide you, if you don't have quick access to that information, we can provide you with the necessary documentation to show your enrollment in the plan and so forth. But I would turn to your estate planner for that.
Can I just interject too? Our financial wellness program,
thank you,
has an estate planning feature. It is free to our AFSPA membership, and I would recommend that you go online to the AFSPA website, www.afspa.org/AIP. You'll see professional services and the financial wellness tool. And if you have any questions, you can definitely reach out. This is offered through Prudential, and they may have just what you're looking for.
That would say that's a much closer one. We just did a question about this for our upcoming newsletter and so forth. So Adrienne, thank you for being a little more awake than I am, apparently.
All right. Yes, please stay on the lookout as well for AFSPA/events, because we will be having lots of Prudential webinars, just like Adrienne mentioned, some focusing on financial wellness, of course. So stay on the lookout there. We're going to go ahead and jump to one of the live questions we just got. Russell has asked, does AFSPA cover any dental expenses?
So we're going to differentiate. I'm going to answer the first part, and then Adrian's, I think, is probably going to have a much longer answer than mine. So I'll talk about Foreign Service Benefit Plan. Foreign Service Benefit Plan offers coverage in the event of accidental injury to your teeth. If there's accidental injury, that's covered. There's also coverage for oral surgery and maxillofacial surgery. So if you have impacted wisdom teeth, they have to be surgically removed. That's a medical surgery. They're just being pulled. That's not considered surgery. We also cover for adults a cleaning and an exam twice a year, and you get a grand total of $36 each time. My guess is you don't have a dentist who charges $36, and if you do, I don't know. But so that's what's covered under the health plan. And I will say we've not been able to change those benefits in my lifetime, literally, not just my time at AFSPA, but my lifetime. Those benefits have been frozen for over 30 years, and we've not had an opportunity to add to those. But we are happy to offer 4 dental plans that Adrian can talk a little bit more about.
Sure, Kyle, I'd be happy to. So as Kyle mentioned, you do have some very limited dental coverage under your health plan. And this was a requirement of OPM that all of the FEHBs had to have some minimal dental coverage, but it's definitely not going to cover your major and even your basic dental services, fillings, root canals, extractions, crowns, bridges. So you will need to add a supplemental dental plan in order to have those services covered. There's the FedVIP dental plans that are excellent plans that you can enroll in during open season or as a new hire qualifying life event. AFSPA also offers 4 different dental insurance plans and 1 discount dental plan. And 1 is an international plan that covers overseas dental services at a higher benefit and can translate your claims, reimburse in foreign currency, or they even have partners, global dental offices that they have partnered with and have screened the same as they would for an in-network provider in the United States. If you're interested, you can enroll in our dental plans throughout the year. Again, the FedVIP, you will have to meet a qualifying life event or enroll during the federal open season. If you're interested in our plans, you can go to, again, the AFSPA website, afspa.org/AIP. And if you have any questions, there's a secure form that you can email us your question, and we'll be happy to respond.
And I just want to mention, I neglected one benefit that's available under the Foreign Service Benefit Plan, and that is limited coverage of orthodontic services up to $1,000, which is technically it's up to 50% of a course of treatment with a maximum of $1,000, and that's every 5 years. There's no age limit on that, so that is one thing that sets us apart a little bit as a health plan when it comes to the dental coverage.
And I don't want to get into too much detail, but I do want to say that even though it's minimal, that dental coverage under your health plan is considered primary. So regardless of whether the health plan will cover that service, you will have to submit to your health plan first, your federal health plan, and then you would submit to your supplemental dental plan.
All right. Learning a lot about dentistry and orthodontics this morning. All right, so we have tons of questions that were submitted from members over this past week, so I'm going to try to go back through some of those. We have a couple of questions about, it seems, weight loss. So I'm going to go ahead and ask, does the plan cover drugs for weight loss such as Wegovy and Ozempic for the morbidly obese?
And the answer to that question is yes. I know for a fact that Wegovy is covered. I want to double check on the formulary status of Ozempic before I answer for sure about that, but I know Wegovy is covered. It does have to go through a prior authorization process, so your doctor would be in touch with our pharmacy benefit manager, Express Scripts, to provide that. and that is ongoing. It is monitored, obviously, just to make sure that the patient's receiving the right support in this. But yes, if that is something that is of interest to you, and you and your doctor together think that's the right way to go, then talk to your doctor. It is covered by the plan, and I'll encourage everybody. You can go and price any medication at express-scripts.com/FSBP, and there's an option there to price a medication. There's also a link from AFSPA.org/FSBP. There's a whole tab about prescription information that you can find along the right side there. But yes, Wegovy is covered. There will be a member cost share, but the plan does cover that per the terms of the brochure. So check that out. If you have specific questions, feel free to reach out to us, and we can provide more specifics about what that coverage is. Great
On that
question.
same wavelength, we kind of have someone asking, is personal training covered as a direct benefit for if someone is diagnosed as obese or morbidly obese?
Sure. And this is a question that comes up at least once a year. For me personally, I'm sure it comes up more often for our colleagues who are handling calls and emails from members, but the answer is no. At this time, personal training is not covered. It is not considered a medical service in the same way that something like physical therapy or occupational therapy is. And so, no, we are not able to offer coverage for personal training.
All right. I did miss another question from Russell, so I'm going to go ahead and head back there. He asked, is there coverage for private adult autism assessment coverage? This would be for autism spectrum disorder and for an assessment for it.
Yeah, and Russell, great question, and actually not one that I have encountered before. My initial response is yes, it would be covered. And I'm doing a little checking if you hear the clacking of my keyboard, but my initial reaction is that yes, that should be a covered benefit. And yes, so yes, that should be covered, especially the assessment part. And then we have specifics around if treatment is required, especially if it's applied behavioral ABA treatment, then there are certain things that we want to make sure that the provider providing that treatment is properly qualified and credentialed. And so there are some steps for that. So feel free to reach out to our care management team at any time. If you are interested, they can walk you through that process and what that looks like. They can also help you identify providers in your area. But if you have specific questions, you're also welcome to reach out to me directly, and I can put you in touch with one of those nurse care managers. We have actually a dedicated behavioral health team, and autism, as we consider it, it covers a lot of different areas, and treatment can take a lot of different forms. But our behavioral health team within our clinical team, it's a dedicated group, and they work with members of all ages regularly who are being assessed for autism or being treated for it. So please feel free to reach out to that team. Look for the information section 5H of the brochure on the care management. Or again, please feel free to reach out to me or anybody at AFSPA. We can provide you that information on how to contact that team.
Perfect. Trying to go into like a little bit of order, so I'm going to start covering questions that we got about some wellness programs. And our first question is from an FSBP member, and they have asked, are the incentive programs just for the primary card holder, or can the family utilize the programs?
Great question. And the answer is the wellness programs that allow you to earn incentives are available for members who are age 18 and older. So not just the primary enrollee, but also a spouse or children who are age 18 and older. And each person who fits that definition of age 18 and older can earn up to $400 per calendar year in incentives. And I will mention that when any member covered by the plan, so even those who are under the age of 18 and covered as dependents, has an out-of-pocket expense, that the reimbursement for that can come out of that wellness incentive account. If there's any money in that, for it's sort of a pool for everybody covered on the family.
All right. The next question, kind of related, is I participated in some of the wellness programs in 2022, but couldn't find a place to submit and receive the incentives. Can I still submit those in 2023? How? And then are there any new wellness incentive programs in 2023?
Yeah, this is a good question. I'll ask this member to reach out to me. There's actually a place in our member portal. If you just go to myafspa.org, it takes you to an option to log into the member portal, or the mobile enhanced member portal that allows you. It's designed for your mobile device, where you can just take pictures of claims and also incentive documents. So I'm not sure what this member exactly has that they didn't submit, but we do ask usually that those be submitted by December 31st for the calendar year in which you receive the services. Go ahead and send them in. We'll take a look at them. And but the best way to do that is through the member portal. There's a place where, if you're familiar with it, it says submit claims. There's also a button right next to it that says submit incentives. And any documentation you have related to an incentive, maybe it was an annual physical, maybe it was the results of a biometric screening and you've got the form that was supplied. Maybe it's your COVID-19 vaccine card or proof of a flu vaccine, things like that, evidence of a first trimester prenatal visit. There are a lot of options there. You can send that in. It basically goes into a different team to evaluate and make sure that those get applied correctly. That's why there's a separate place to submit those. In terms of new wellness programs in 2023, there are some new wellness programs. There are some ways that we've also revamped it in the last year. And I appreciate my colleagues in the background have put up the link there where you can find out new for 2023 on our website, just highlighting those things. But I'll highlight in particular, we've revamped the Healthy Pregnancy Program. And so now members can earn additional incentives for a first trimester prenatal visit, enrolling in the Healthy Pregnancy Program, having a call with one of our nurse care managers around 28 weeks to discuss your birthing plan, and then having a follow-up call with one of the nurse care managers about 4 weeks post-delivery to check in, because just because baby is born doesn't mean everything's as it should be and everything's perfect. We want to make sure we're providing that ongoing support. There's also a growing number of programs that are available through the Lifestyle and Condition Coaching Program, or LCC. There's a lot of options there to support you in meeting your health goals. Maybe it's sleeping more or eating better, or managing a chronic condition, including, we had the question before about obesity. There are programs to help with that. There are also programs, speaking as a person who lives with diabetes, to help you manage diabetes and nutrition and so forth around that. So check those out. They're adding new programs regularly to the LCC program.
All right. All right. So I think we're going to jump back to AIP real quick, or let's see.
Your turn.
This question asked, I believe this is AIP. The immediate benefit plan steps in to help cover immediate expenses, but I was told I'm not eligible for this benefit because they are a DoD education activity civilian teacher. They want to have these benefits, but how do they get them?
So, unfortunately, it is not available to employees of Department of Defense at this time, and has never been since the inception of the policy in 2003, for reasons that predated my employment at AFSPA. I would say or advise that if you go to the SAMBA website, I believe that Department of Defense may be eligible for this plan, but they have a similar plan where. Sorry.
Agreed. I was able to check, and in fact, the DoD is not an eligible agency under the SAMBA option.
The SAMBA option as well. Unfortunately, we do not offer it to Department of Defense. It's an immediate benefit plan. Maybe you can Google a individual policy that is available.
Yeah, and Adrian touched on this a little bit, but the reason it's not available is that we to ensure that it's active employees who are enrolled in this, and that we're able to get information directly out to get the benefit directly out to beneficiaries.
Yes.
It has to be done through for our purposes, it's done through a payroll withholding. Yes. And right now, the only group we're able to successfully work with on that is the State Department. This would mean working through DFAS. We're having trouble with National Finance Center, as it is with a couple other agencies that have been eligible. And so that is the main reason. It's also getting immediate notification from your employer of someone's passing so that we can take action on that. And so there are some things. It's not something that we are saying no will never happen, but it's not available now, and it's not in the immediate future.
Thank you.
We have another question about, Department of State now. They have asked, I've been on my spouse's plan for a decade and recently became I'm assuming Department of State civil servant and qualify for my own account. Are there any benefits to be signed into the plan separately versus a self+1 plan?
Yes, there are. And I'm assuming since you mentioned self+1, that is just you, and no other dependents who are eligible on the plan right now. So the main fit for two self-only enrollments is that it's less expensive, and that's true of, I think, every plan in the program. Two self-onlys is less expensive in terms of premiums than self+1, and there's actuarial reasons behind that. And I should also mention that with Foreign Service Benefit Plan, and I think a third of the plans in the FEHB program, so about more than 90 plans, self and family actually will cost the enrollee less than self+1. So just something, if you're out there, if you have a qualifying life event looking at possible changes, that's something to think about if there's just two people in the family. But if both of you are eligible in your own right for FEHB coverage, yes, two self-only plans will cost you less. And so that's the immediate option. And there is, I believe it's qualifying life event, I'm double checking this, 1P is in Paul, that allows you to make a change and enroll. And I also believe allows your spouse who's covered you under the self+1 to step down to self-only coverage. And I'm confirming that right now. It's 1P as in Paul. And that allows your spouse to make that change. You would just be enrolling as a new enrollee within your first 60 days of hire. That's your window until another qualifying life event or open season. Here's one thing I will advise you if you all are both enrolling in two self-onlys. Make sure that you filled out HIPAA authorization forms for each other. So if your spouse is acting on your behalf and calling with the claims question or coverage question or something like that for you, that we can answer those questions. Same thing that you should be authorized for your spouse, because there's a very limited amount of information we can provide to someone who's not the person about whom the question is asked. And also, especially if you're not on the plan together, there's limited information we can provide. So please keep that in mind. The HIPAA authorization forms on our website, afspa.org/FSBP. Look for the forms and brochures, and keep going. So and you can fill that out there, and there's information how to submit that. We've got that on file.
Perfect. So it is 11:30, but we received so many questions from our forum, and we're still getting some questions through our social media channels that we are going to keep going for a bit, just to try and answer as many questions as possible for our members. So we just got another question in from YouTube, and Marion has asked, what do I need to start using the massage services? Great question.
The name of a massage therapist and an appointment with a massage therapist. That's all you need. You can go in and check and see about a network massage therapist. There are not that many. You're more likely to find a chiropractor or an acupuncturist who is in network, but you can try to find somebody who's in network. Otherwise, just make an appointment with the massage therapist. You will have to pay at the time of visit in 99% of those situations. Again, unless they're in network, you'll pay and then you'll submit to us. But here's the thing, because I keep running into this with people both stateside and overseas. When you submit that claim to us, we need some information. And ideally, we need that information on something that comes from the provider. We need the provider's name, the provider's address, the date of service, specifically what services were provided, the cost of those services. We need your name and your ID number on there as well. You can write those on if you need to. But the other thing we need is some sort of identifier for the provider. So it may be their license number, it may be their tax ID number. A lot of massage therapists may be working on their own, and so their social security number is their tax ID number. That's okay. They don't have to share that, but they can put their license number on there. If you want, some people, especially overseas, will get a picture of a license hanging on the wall, a business card that shows the information about the massage therapist, a picture of that, and the receipt from the massage therapist that literally says massage 1 hour, $100, the equivalent of $100. We're going to pay $60 for up to 50 sessions per year, but we need that information. We cannot reimburse you for something that's just a credit card receipt or cash register receipt. We need a little bit more than that. So please keep that in mind. We've got the information in our brochure and on our website about that, but we do need that additional information to be able to process claims.
All right. We got another question from YouTube. It looks like Grace has asked, they live in Panama. Their spouse is on a special diet of clinical insured. They want to know, is it covered by insurance?
There is coverage for what's known as medical food under the Foreign Service Benefit Plan, but I don't know that clinical insure meets that qualification. I'll ask this person to reach out to us, either me or just one of our health benefits officers, and I would, and we can get that answer for them. I believe that we would probably need specifically what it is. If it's clinical insured, that's good. Might need a little bit more information. It may have to be prescribed by the doctor. That may be happening, but we need a little bit more information. I don't feel comfortable answering that here because this would be something that that our clinical team would have to review, both in to answer the question, but also to process the claim. I think that is the best answer I feel comfortable giving in this instance. But Grace, please reach out to us. And my name is Kyle Longton. It's kyle.longton@afspa.org. And I would be happy to get you an answer on that.
All right. I'm going to try to hit some of the overseas questions that we've been getting. Kyle, I know that you did a podcast episode recently about kind of what's been happening overseas in Japan. So related to that, Robert has asked, what kind of assistance can you be to those of us in Japan who have been denied healthcare at the Navy hospital? They're paying 200% of a surcharge and having trouble finding care.
Robert, thank you for this question. I as Maddie noted, the most recent episode of AFSPA Talks, our podcast, I did sort of an overview of what is covered in Japan, and I've more recently had. So I encourage you to go listen to that. But you probably have that information. I will say that more recently I had a call just last week, almost 2 weeks ago, with a group that are advocating on this issue, some teachers and others, but all civilians who are advocating on this issue in Japan. They gave me a more detailed overview of sort of what's going on. We are researching possible direct billing arrangements with new providers. We have limited direct billing arrangements in Japan. I am aware of the surcharge. I know it's not just Japan where this happens, but I know it's hitting you all hard right now, and while things can be reimbursed, it is a lot to pay up front when the hospital is requiring that. So I will tell you, I've had conversations with DHA, and I'll be connecting with them again just to find out what they're doing on their side. But I think you probably are aware that they've been having town halls and so forth. So I won't comment any further on that. We've been in touch with OPM also about the challenges that members are facing there. We've been in contact with our direct billing partners in Japan, but in most cases, those agreements cover only inpatient or wellness, I should say preventive care, and not the general outpatient care. We're working to see if there are options to expand those arrangements. We're also looking for perhaps a telemedicine provider that's based in Japan. Our V-Health group is great, but they are not able. They can just provide essentially consultations to members in Japan. They can't write prescriptions for members in Japan. So we're working on that. I have a bit more information about the challenges of getting prescriptions both through home delivery and getting prescriptions sent to Japan to be filled at the military treatment facilities. That some of the MTFs don't have a fax line, and there's no way for them to receive electronic prescriptions at this time, and so they have to literally be sent with a wet signature through the mail. What I can say is that I am learning more, and I'm working with our partners to see what options there are. I don't have a good answer right now, and I'm sorry. I can tell you, send the claims in. We won't be reducing. We accept what the provider bills overseas as the plan allowance. So we won't be reducing it to a fee schedule, or well, no, this is what they charge Japanese nationals, anything like that. So in terms of paying the reimbursement, we've got that. In terms of finding access to care, we are working on that. I welcome anybody in Japan who probably are not watching right now. I think it is currently approaching 2 a.m. for them. But if you're watching the recording, please, if you have suggestions of direct billing facilities that we might partner with, send them to us. I have 5 or 6 that we'll be working on in the weeks ahead. I've been in touch with the embassy. They provided a recommendation or 2, but please send those to us. We want to do what we can to ease access to care, and keep the issues in front of us that you're facing.
All right. Another overseas question. Matthew has asked, what are the best practices for obtaining non-emergency medical care overseas, such as medical screenings, dental work, checkups, particularly at, I'm not going to attempt that word.
Austere posts, we'll say.
Yeah, austere posts, where even routine medical care does not meet U.S. standards.
I'm going to take a quick drink of water and ask Adrian, can you talk a little bit more about the Cigna International plan, and you know about the health plan as well. So I'm going to sit back and kick this one to you, if that's all right.
Sure, not a problem. So I'll start with the dental work. So there are some options to receive quality dental care when you may be assigned to an area where that's not available. What we've seen historically are a lot of Foreign Service employees opt to have or schedule their dental visits when they're on home visit. And if you know the time that you're going to be visiting home, you can make your appointment earlier during that time, and in case you have subsequent visits or more than one visit. And that seems to work. Another thing that's becoming very popular is what we call dental tourism. So you may elect to have dental work done outside of your country of residence. Americans are having services done outside of the United States, usually because it's quality dentistry and it's much less costly. We do offer, as I mentioned earlier, a Cigna International dental plan. And what is great about this plan, again, is that they have partnered with over 100,000 dentists globally. And if you enroll, you can get a referral to the closest dentist or dental office to where you currently reside. They'll even set up that initial visit for you. And perhaps that will be helpful. With the health plan, if you are enrolled in the Foreign Service Benefit Plan, then any non-medical services would not be covered if it's not under the health plan. So the same thing would apply. You would need to wait to come back to the U.S. to arrange those visits for those services, or perhaps it will maybe be out of pocket, but you can also find a medical provider in the country, maybe not where you are, but in another city or in a country that's close by. I know that some members combine their vacation with scheduling these services.
Yeah. And I'll just say, I know we're talking about non-emergency and sort of routine care. Of course, if you are in an urgent or emergent situation, and I'm assuming this person is talking about foreign service posts, embassies, and consulates, and other missions outside the U.S. If you're in an urgent emergent situation, you got the coverage from the support from the Bureau of Medical Services that they get you on the next commercial flight or send an air ambulance for you. And we did a podcast last year with the then Chief Medical Officer, Larry Paget. We talked about just overseas care, and he talked about how that works. He also, in that episode, and I want to say this was last July, that we talked about just sort of how people go about getting care when they're overseas. And he had some good advice for people, particularly when it comes to routine non-emergency care. But as Adrian mentioned, a lot of times, if that's not available locally, you're scheduling that at times when you're on a TDY at another post, or when you're back in the States or at another country. So it is something that again, I'd encourage you to listen to that podcast with Dr. Paget and talk to colleagues about how they manage that.
All right. I'm going to answer or do a question that I know one of our members really wanted answered. Jeanette has asked, I found a therapist that I like that charges $150 per hour. She doesn't accept Medicare or insurance, and they want to know if there's any part of this cost that can be covered by AFSPA or the Foreign Service Benefit Plan.
Sure. So I'm going to answer first if the member has Medicare, because it's not mentioned she doesn't take Medicare. So if the patient, in this case Jeanette, has Medicare Part B, and this provider, there's three different types of Medicare providers. I'm going to try not to get doing it. There's those who participate with Medicare and they accept whatever Medicare says is the allowance. There's non-participating. It's a bit of a misnomer, but basically it means that you can file for reimbursement from Medicare, but it's the provider can charge up to 115% of the Medicare allowance. And then there are those who are opt-out providers. And mental health providers, behavioral health providers, I should say, are one of the biggest groups that opt out of Medicare, because most of the time they're single practitioners. Sometimes Medicare is not going to cover it anyway, and so they choose to opt out. So if this provider is an opt-out provider, and if this member has Medicare Part B, there's a lot of contingencies here, then you can absolutely file a claim with Foreign Service Benefit Plan. However, in that scenario, opt out and you have Part B, FSBP can only pay what we would pay if the provider accepted Medicare, which is about 20% of the Medicare allowance. Now, if the provider doesn't opt out of Medicare, they're just non-participating, so they'll maybe charge more than the Medicare allowance, then yes, Medicare may pay that. I can't speak for what Medicare will do. Once you've got the information from Medicare, whether they've paid it or if they've denied it, send it to us, and we will consider that. If you don't have Medicare, then and this provider just doesn't accept insurance and they're just out of network, send it to us. We have out of network coverage for all providers in the US, if they're not in the network. And it's usually after that there's a slightly higher deductible for out of network coverage when we're talking about outpatient. And then we usually pay about 70% of the plan allowance rather than 90% of the plan allowance with an in-network provider. So there's still coverage, but again, there's a lot of contingencies and a lot of things to figure out with this member. So I'll see if we can't get that member a little bit more information just about her specific situation. I'm glad, though, I will say I'm glad she found a provider that she likes and she's getting the support from that provider that she needs. That's great news.
Absolutely. All right. So we have two more questions, I would say. So if you're watching live and you really want a question answered, go ahead and put it in the chat and we will answer it. For now, I'm going to ask a question from one of our members who has asked that they are retiring next week. They want to know if the medevac insurance stays with them. Are they still covered if they have an emergency while traveling as well? And they understand that FSBP stays with them.
Okay, so congratulations on your retirement. That's exciting. Your FSBP, you've got the paperwork, you filled it out, you sound in the know, you're keeping your FSBP. You still have coverage per the terms of the brochure. The coverage does not change, but the official language in the brochure is that we will pay for transportation, so ambulance or air ambulance when necessary, to the nearest facility equipped to meet your needs in a medical emergency. That may be a hospital. You're overseas. That may be a hospital that's 30 minutes down the road. It may mean that you have to go to a different country for the services that you need for the treatment. The FSBP does not cover repatriation to your country of origin for services. It does not include a specific medevac unless services are not available locally. However, we do offer some travel insurance, and Adrian, I think we've got some coverage for return to country of origin and some things like that under some of those travel insurance plans. Is that right?
That is correct. So in the event that you may be on vacation and want some added security, in the event that you fall ill while on your trip, we do offer travel insurance, and the travel insurance plans do have a medical evacuation benefit embedded in the plan. It will medevac you back to your home, your home country or home state, or your country of residence, and it usually is based on a dollar amount, and for the most part, and for our plans, it's up to $1 million. So more than enough to get you back home.
Yeah.
This is supplemental. Yes, go ahead.
No, go ahead. I'm sorry.
No, it is supplemental, and it's usually they have limits on the duration of the trip, but they do vary. We offer 4 different travel plans. So out of those 4, you should find one that would benefit you, and there are benefits for repatriation of remains. There are benefits if you need to, your travel partner needs to return home, but you are still in the hospital. They have coverage for that. If you need a family member, if you fall sick and are in a hospital, they will pay for that family member to come and stay with you for a certain amount of time. All of those are comforting when you're traveling.
Mm-hmm. I'll just say, these travel plans that Adrian's talking about are a little different than the plans that are offered by maybe your airline or something like that when you check the little box when you're finalizing your travel plan. So take a look at those. Adrian's team knows all about them and can answer questions you have. But again, that's you can see the link there on the screen. AFSPA.org/travel will take you to those options.
All right. We have a question from YouTube. Patrick, your question was actually what I was going to do next from our forum, but thank you for sending in a question. He has asked, our family will be retiring overseas. Since he cannot use Express Script, can I buy medication locally and send it in for reimbursement?
Great question. The first thing I'll say is that if you're on a maintenance medication, you may still be able to use Express Scripts. They may be able to do home delivery of a maintenance medication. It's something you're taking daily. That's not always possible if we're talking about maybe something that is temperature controlled and so forth. But it can be for a lot of medications. They can still do home delivery even overseas. But check that if it's possible. If not, the answer to your question is yes. You can buy medications locally. Obviously, they'd be prescribed by a local doctor, and you can submit it to us. I recommend submitting a copy of the prescription that the doctor writes, as well as the pharmacy receipt. Send that to us, and we process it like an outpatient claim. We consider it at 90% and reimburse that, and you're responsible for 10% of the cost. And this goes for anybody who's filling medication overseas, not just people who are retiring or resident overseas. If you're traveling, if you're posted overseas and you're getting your medication filled overseas, we send it to us. Again, I recommend a copy of the prescription and a copy of the pharmacy receipt for us to process the claim. That's the most helpful. And also a note when you send it, hey, this was an antibiotic for strep throat. That also helps us a lot to process that quickly.
All right. We have another question. Someone has asked, can you brief on disability insurance options? Do any offer lifetime benefits or just for a limited number of years?
Adrian?
Yeah.
Any offer lifetime benefits or just so the plans that we offer, there is a limit. There's a limit to the number of years. It's 5 years or 2 years. And if you think about it, for most disabilities, these are not permanent disability coverage for permanent disability. Our coverage is for total disability. Once you become permanent, then you usually will automatically default to your workplace
the FERS will kick in.
Yeah, FERS, or I think there's another one for foreign service. So this is to cover you for a temporary period of time. And my thinking is that if you have a disability for more than 5 years, it's probably going to become permanent. So this is temporary coverage.
All right.
And I'll mention we do offer, Adrian mentioned we offer various plans. You got the link there on the screen. We do have different options within those plans, and they take into account recent changes in things like family leave for federal civilian employees and so forth. So check out those. Again, Adrian's team is ready to answer questions you might have. That I'm enrolled in one of these plans, and it is or have been in the past. It is very reasonable coverage for what you may need, and we do have a higher limit now for more highly compensated employees to help fill that gap. But it is a partial income protection when you're facing a disability.
All right. I am going to answer one question that I know how to answer. Someone submitted a question and they were just asking to run through an example of how to enter medical claims. We've talked a little bit about it today, but thankfully on our website, we do have a YouTube video that walks you through step-by-step how to fill out a claim. Medical care can be confusing, and we understand that. So, our website has plenty of resources, and I think we're going to wrap it up for today. This was a great session, I believe. Thank you so much, Adrian, for joining us and giving us all of your AIP knowledge. Thank you, Kyle, again, for being here with us every time and helping answer all the questions. We will be back next month, March 30th. It's always the last Thursday of every month, and we cannot wait to see you guys there.
Thank you, everybody. Thanks for the great questions. And Maddie and Adrian, thank you all as always.
I enjoyed it. Thank you.
All right.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.